Thank you for checking out this video. I'm a chiropractor. I absolutely love what I do. Unfortunately, most people are not very familiar with chiropractic. In fact, in the state of Massachusetts, at best, only 15% of the population is ever considered going to a chiropractor. In 1968, a law was passed, and chiropractic was not legal in Massachusetts. We were the third to last state in the country that has laws governing chiropractic. Now every state in the country has laws, plus 40 other countries. Unfortunately, some people are afraid to go to chiropractic, which is so sad, because chiropractic is not the least bit dangerous. Taking pills and potions and surgery is dangerous very often. It's so important to us that people understand what we do. In a nutshell, if a bone is twisted in the spine, it's going to pinch a nerve. Now if something's twisted in the low part of the back, it can affect everything up above it too, because the whole spine is one functional unit. Now pinched nerves can be very serious because nerves are an extension of the brain. Nerves carry the energy from the brain to every single piece and part of the body. The most important thing to understand is that the brain makes the body work, and nerves are an extension of the brain. So it's the brain and the nerves that are 100% responsible for the beat of the heart, for the exchange of the oxygen in the lungs that makes us breathe. Nerves are responsible for the function of the stomach, the kidney, the bladder, sinus, and vision, balance, everything but everything is controlled by the brain and the nerves that come out of the brain. So now if a bone is twisted anywhere in the spine, it could be responsible for neck pain, pain or numbness down the arm and the hand, tennis elbow, carpal tunnel problems, chest pain, bad monthly cramps, low back pain, or that excruciating sciatic pain down in the leg, which can cause numbness also. Now it all depends what nerve has pressure on it. This is a picture of the spine from the side. Obviously it's been blown up a little bit. This is a good nerve here. Now the second bone is shifted backward and it's pinching this nerve. Now that's not one nerve. There are millions of nerves between every single bone. Only 1 out of 10 nerves has anything at all to do with pain. So you see, our job is not necessarily just to get rid of an ache or a pain. Of course, we want you to feel good. And also, most people go to chiropractors just because of the aches and the pains. But again, only 1 out of 10 nerves have to do with pain. So our job is to open up the nerve channel, straighten the spine, and get out of the way, and get you to exercise and take care of yourselves. Because if there's pressure in a nerve like this, it goes up into the ear canal. The little kids like this over here are more prone to having ear infections. In this country, at least 1.5 million kids every year get surgery on their ears, have tubes put in to relieve their ear infections. And it's funny how the body tends to reject those tubes. A lot of kids get 2, 3, 4 sets of tubes. If there's pressure in a nerve to the lungs, the kids are going to be more prone toward having breathing problems, allergies, hyperactivity, bedwetting. Ann Landers wrote an article 20 years ago saying that, gee, if you have an 8-year-old child that's still wet in the bed, try chiropractic. I would stake my reputation on the fact that if a kid's wet in the bed, he's still 6 years old, 3, 4 adjustments, 80% of the time it's going to take care of the problem. Chiropractic isn't a cure-all, but it works pretty darn good. And now we all have our own responsibility too. We have to exercise, we have to stretch, yoga, flexibility, stretching, and relaxing. I absolutely love what I do. And if we can get rid of any nerve interference in the spine like this, the body is going to be healthier for it. If you ever have a question when it comes to your health, demand an answer, because ultimately we're all responsible for our own health. Thank you for listening to this video, and please forward it to a friend that's considered going to chiropractic but not quite sure about it. And you can also give us a call if you ever have any questions. Thank you very much and have a nice day.